Hi guys, good to have you with me. Thanks for watching us on Fever FM. Thank you for tuning into Fever 104 FM. 10th of October, today is World Mental Health Day, and we thought why not use this opportunity to raise awareness, to talk about mental health. And during the times that we are living in right now, battling a pandemic, there's so much spoken about one's health. But are we giving enough attention to mental health? So joining me in the studio today is a renowned doctor from Namma Bengaluru City. She's consultant psychiatrist, MBBS MRC psychiatry with over 18 years of experience. We have Dr. Priya Raghavan. Welcome to Fever 104 FM. So nice to see you.
Yes, same here. Thank you very much for inviting me here, Sriram.
And here's wishing you a very happy World Mental Health Day.
Thank you, and same to you as well, and to all of yours.
How is this day usually treated in the mental health fraternity? Is this day given the due importance that it deserves?
It is gaining importance. We did not have as much awareness in the past as we are doing now. And, with all your social media and then people like yourselves and people in general becoming more aware of it, certainly it's gained more importance than before. But I think we could do much more. We have a long way to go.
I'm sure.
But getting awareness is the first step towards everything else and towards achieving optimum mental health.
Lovely. Doctor, there is a perception that only an individual with mental health disorders needs to visit a psychiatrist. I'd like to believe that we have advanced from that stage, but you can probably give us a ground reality of how true this is.
Right. People with mental health disorders certainly need to visit a psychiatrist. There's absolutely no doubt about it. And when we say mental health disorders, what we simply mean is people having symptoms of mental illness. It could be, mood problems, severe anxiety, suicidal thoughts, seeing things, hearing voices when there's nobody, taking too much of drugs, alcohol. It could be any of these, or it could simply be, difficult behaviors. So whilst these may be classed as symptoms of mental illness, it does not necessarily mean that others should not seek help or, seek the help of mental health professionals. It may not necessarily be a psychiatrist, but it would certainly do them good if they saw mental health professionals should they feel the need in terms of any disturbance in their thoughts or behaviors, if they feel it's going out of control.
Right. And do you definitely, you meet so many individuals. You think there is enough and more being done for people to reach out? You did say that there is plenty more to be done as well. You still feel that in our country, talking about mental health is taboo?
Absolutely. It remains very much a taboo until this day. We only have a small proportion of people who are actually seeking help. And in fact, a lot of the people that we see are in the advanced stages of their illness when, not much can be done, although we do try and do our best. But if they were to come earlier on, it would be much more, interventions would be much more effective, if that makes any sense. But as I said, we still do have a significant taboo in our country, and that is something we need to overcome. How do we do this? First of all, I think it has to be done at different levels, isn't it? At the level of the individual public, where they need to become much more aware that it's okay to seek mental health experts' input, because not all of us are perfect. We are not perfect all the time, and we can falter. In fact, I think a lot of research shows about, 1 in 4 have some anxiety or depressive symptoms at any point in their life. So it's really high. Numbers are really high. But what actually shows at our doorstep is much smaller. Just think of it as another problem like BP or diabetes, where, some people might need medicines with regards to anxiety, depression. Some people might need talking treatments. Some people might need both. And there you go, it's done. Why don't you see it as a chemical imbalance instead of actually making it out to be, such a big issue wherein, you don't want to go and see mental health experts. So that mentality has to change. And I think we as organizations and, mental health organizations, we have to offer much more high quality programs, raise awareness. And I think we need a lot of governmental help in this as well, in terms of legislation, policies, and developing services much more.
Right. As a country, there's so much of diversification. There, almost every 50 kilometers, you see cultures change, traditions change,
Yes.
perceptions and beliefs change as well.
Yes.
But do you see a common thread when you see individuals seeking out for mental help? What seems to be plaguing us as a society in general, Doctor?
It would be very hard to actually pinpoint one single topic. However, when I actually think about it, I do think at this point in time, our addiction to media, our excessive use of gadgets is probably the one thing I would actually pick out on, because this is something that's happening across age groups, if that makes any sense.
Yeah.
Yes, people who come to us, the common thread amongst them is that they need help, and that's why they are seeking help. But if you look at, mental health beyond that, I think gadget addiction is becoming a big thing. And without us realizing, I think it's assuming actually pandemic proportions. While there are a lot of good things about media, internet, screen time, I think we are somewhere failing as a country, as a population, to actually use it in a much more regulated fashion.
Yeah, I mean, it could be frivolous reels. It could be just watching content that we didn't even know we needed.
Yes.
I see a lot of the times I am mindlessly scrolling. I don't even know what I was looking for in the first place, but there I am, stuck in the rabbit hole.
Yes.
It's been 15 minutes and I'm just mindlessly scrolling on my phone. And that could be a lot of us.
Absolutely. Many of us. As I said, we see it across age groups, and even we psychiatrists, or, many doctors for that matter, what do we do when we don't have patients? The next thing we do if we don't have any work is that before you know, we are looking at this thing in our palms. It is not constructive at all.
Right. You bring up a very interesting point, and when you say as mental health professionals, what do we do? We are also dependent on technology and the phone. Say for mental health professionals, from time to time, are there a lot of interventional conversations and things done to take care of mental health professionals' mental health as well?
As a community of professionals, if I have to think about it, not much is being done apart from having, mental health, what we call psychiatry conferences, etc., across the country, which is your chance to network with people, speak to them, have a chat, exchange professional views, ideas. And beyond that, also engage in, various team building activities like, our psychiatric network offers, cricket, but it's mostly confined to men, male psychiatrists. Having said that, apart from this, there does not seem to be much of a space for us to actually seek help if we needed to.
So that way, every now and then, it does make sense for you also to take a break, because I'm sure as soon as an individual meets you, they are an open book and they start to just speak up as much as possible.
Yes, that's not the case all the time. Not everybody wants to open up, or once they come to psychiatrists or psychologists for that matter. It takes a lot of work many times for them to even get speaking to us. Having said that, I consider our profession as being very privileged, because we get to hear these people's innermost secrets, innermost beliefs, their insecurities, etc. But nevertheless, I think the whole idea, once they start speaking, is to, of course, try and help them, be it with medication, talking treatment, or any other means.
Right. Today is World Mental Health Day, and I truly believe that it's so very nice that we have a mental health expert, a psychiatrist with over 18 years of experience, who is here in the studio. And if given an opportunity, a lot of people would like to call up, interact with you. And of course, no amount of consultation over a phone call or a radio station show can fulfill sitting with you and having a conversation with you.
Yeah.
But over the radio, if you could talk to us about a few things one can keep in mind to take better care of their mental health, what would it be, doctor?
Basic things, basic lifestyle changes is what I would suggest for all of us. The first thing probably in that would be to cut down screen time. I think that's emerging as a top tip, if that makes sense. Some of the other things, we do need to take some time out for some form of exercise, anything you like. It could be dance, it could be swimming, it could be yoga, walking, even a 10-minute, 15-minute walk, I think, on a regular basis is going to go a long way. Other than that, I think, keeping a line of communication open, be it with your friends or relatives, whomever you trust. It's important to have that contact going, meet your friends or your relatives regularly. And most importantly, if anyone has signs of mental illness, like the ones I told you earlier, severe low mood, or it's there all the time, you're feeling low far too frequently, feeling anxious for anything and everything, or any other symptom, then do seek help.
What are some of the biggest misconceptions, doctor? Since you are a psychiatrist, you meet a range of people, I'm sure. But patients aside, what are some general misconceptions that people have towards mental health?
So mental health itself is a taboo. So if we start off about that, then most people feel that they should not be seeing any mental health professionals, including psychiatrists or psychologists, because they feel they are mental or they are mad, which is unacceptable in society, and that it does not happen to people who are strong, if that makes sense. But that is the biggest taboo, and I think if we could overcome that hurdle, we'd be able to move a long way. The second misconception, in my view, that's pretty important, especially as a practicing psychiatrist, that is someone who prescribes medication, is that people feel, very often we hear people saying, no, don't give us medicines. We don't want medicines. It is addictive, or it's got too many side effects. And there is this misconception that all psychiatric medicines cause side effects, which isn't true. Yes, there are side effects in every tablet under the sun, including paracetamol, Dolo. But we need to, weigh the advantages versus disadvantages, find out what the side effects are, have that conversation with your doctor, and then come to a decision. Not all will require medicines, and not all are suitable for talking treatment. So your psychiatrist or psychologist will be in a good position to tell you what treatment might work best for you. The third misconception is very closely related to what we just spoke about. People Google all their symptoms now, as you know, because it's widely available, and I'm not saying no to that. They also Google treatments. These are things that they should do. I'm not discouraging them from doing that, but don't be carried away by that opinion is what I'm saying, because there's an information overload on the internet. Bring that information to us, speak about it to us, and we will help analyze that information for you and tell you as experts what is true in that, what is it that you should be considering and what you should avoid. So these are some misconceptions I think we need to work on urgently.
Valid. So very valid. And a lot of the folks who are tuned in will probably resonate with what you're saying. I want you to shed a bit of light about our country, which is so very unique. And you're someone who would be perfect to answer this question because you've had exposure in Europe, you were practicing in the UK and in India as well. As Indians, family, culture, people being close to you, there is difference in culture, but at the same time families sometimes can turn out to be very toxic for an individual. It may not be the right setting for an individual. How do you see families turning out to be of a lot of advantage and sometimes being a disadvantage in one's mental health?
We see this quite often. A lot of people who actually come to us a lot of the problems are stemming from families who mean well but do not understand mental health
Right.
or the symptoms. So I think it becomes our job as a mental health team to help families also build awareness around what the symptoms are. And it's not just about symptoms, it's about the impact on the individual's life and around others. So although they start off sometimes from a disadvantageous viewpoint, with the right kind of help from psychiatrists, psychologists, social worker, etc., from a team approach, more often than not, I think we can get to some sort of understanding. Families will come to some sort of understanding, about how to deal with this person who has the illness in their family. And that allows the patient and the families and us as professionals to manage symptoms so much better and improve everyone's quality of life.
Right. I think here, be it different relationships, husband and wife, or a mother-in-law and a new daughter who's come into the family as well. A lot of things have a social or a society connect attached to it. So a lot of the times we are in between cross cultures, I feel.
Yes.
And most of the times it's like, this is how it's meant to be. But people feel so very uncomfortable, even though they don't want to be in that position, but they have to be because the society says so. But as an informed, as an educated society, we want to question the norms.
Yes.
And we want to find a balance of what is right for each individual. So seeking help, seeking a mental health expert or a professional's advice could really go a long way. And there are times when you sometimes may seek advice from a family member, and if you say, I'm feeling sad, an answer would be, don't feel sad.
Yes. True.
If only things could be as simple as that.
Absolutely. How can you stop feeling things? How could you stop that? Isn't it? That's a misconception again that we have, and we have to, again, comes down to have a better understanding of these things. But like you said, yes, we are right now conflicted between different cultures. Also thanks to media for that, because we have so much access today to, the Western culture or even Indian culture than we ever had before. And there's a lot of confused minds, if that makes any sense. And there is also understandably a clash of generational views and values. But I hope these are things that we will, come to some sort of understanding with time. But if, again, that's something that's causing too much of stress, then that's an indication you need to come and see us.
Yeah. What's right, what's wrong? It is so very subjective.
Absolutely.
So I just hope it's not the society that gets to dictate what's right and what's wrong, but it's an individual's choice,
Yes.
more important than anything. Doctor, do you think popular culture has depicted mental health and the approach to mental health has been right, or you still feel that there are a few hits and misses?
They are trying their best to depict mental health as something that, you need to seek help for.
Mm-hmm.
But I think this is something that needs to improve. We need to get a bit more realistic about how we depict these things. Some of these things are exaggerated and a bit unrealistic. And that sometimes impacts us professionals in the sense the expectations sometimes rise and they're not always practical. So I do believe that whilst, the media and, popular culture need to depict mental health, there has to be a change in how they actually do it.
Lovely. Well, if we get hurt, we seek the help of a doctor.
Yeah.
If we physically get wounded, then the doctor to visit. If it's relating to our bones, then you see a bone specialist.
Yes.
Similarly, a mental health professional needs to be visited when you are feeling not your best. And every once in a while, a little bit of a tune-up never really hurt anyone, did it? So it makes absolute sense to not just talk about this today, but the rest of the days of the calendar as well, to give the importance that mental health deserves. Doctor, a big shout out going out to all the psychiatrists, the folks who are working behind the scene and who are helping each individual reach out and being accessible and bringing tremendous amount of difference to one's lives. Thank you for making that happen. But to all the folks who wish to be psychiatrists and to become a mental health expert to help other individuals, what would you like to share with them today?
Well, we've got plenty of work to do, so please I welcome all of them. We need more mental health professionals, be it psychiatrists or psychologists, in our country today, much more than ever before. But the one thing that I would like to say to them is, yes, apart from working very hard, getting to know your patients, getting to know their stories at the individual level, it is very, very important for people who are entering the profession to be very closely involved in research. Because this is something we as a country are still not very good at doing, be it mental health or, the medical profession at large. I think our country needs to surge much more ahead and play catch up with the rest of the countries. So we are able to actually drive treatments. We are actually able to, if you like, call the shots in the first place, which we are not doing. We are very good at following what's being followed, what's being done in the rest of the world, in the West. But I think we need to be at the forefront of medical research. And this is my advice to people who are actually going to take up the profession.
Well, there you have it. A lot of words of encouragement. And like you said, your work is cut out for the amount of awareness and at the same time the help that a lot of individuals need in terms of mental health. Thank you so very much for spending time with us. I wish everyone who's tuned in a very happy World Mental Health Day. And like Dr. Priya said here, let's look at giving our mental health the attention that it deserves, listen to ourselves, probably cut down the screen time that we are all involved in these days. It's scary because even when driving, people now use cell phones. Your cab driver is probably watching something as he is driving you about. And that's just the kind of dependency that we have today.
Yes, we all do it. And as a society, we need to cut down. I think we need to become more aware of it.
Right. Before we wrap this up, I'd just like your inputs on one final topic, and this is to do with resting, right? Because getting adequate sleep as well these days is a privilege, and not everyone has that privilege, be it the rich to different economic stratas.
Yes.
You probably have this problem where your mind is just constantly thinking. At one point of time, you felt that days are long and you're living probably a long life, whereas these days seem to be flying by. Is that because of information clutter? And if one is having trouble getting to sleep, falling asleep, what would you like to share about this topic?
Some tips for normal sleeping. There's something called sleep hygiene or sleep routine, and this is something we all need to try and follow. It's basic things. It's not that it's born out of common sense, but also based on evidence. Try and go to bed at more or less the same time every night. Try and have a bedtime routine if you don't have it. If you have trouble falling asleep, say for example, before you actually turn off the lights, you may want to have a cup of warm milk, and then you may want to have a hot shower, and then go to bed, turn off all the lights. And what I tell many of my patients is keep a bed lamp on and try to keep a very, very boring book, so with the hope that you're, eventually going to fall asleep. But once we start doing this, over several weeks, I do hope that a lot of normal sleep might be restored. But this is a habit that we need to build. It takes a bit of time and patience, and cut out the caffeine, if possible, beyond 5 or 6 in the evening. Not too much Red Bull, Coke, Fanta, Pepsi, none of your fizzy drinks. These are some things you could do. So, you're trying to inch towards a normal sleep.
I'm making notes. And that question was for a friend of mine.
Right. I hope it helps.
But thank you so very much, Doctor. We could go on talking about
Yes.
multiple things that could be plaguing us as a society and beyond. But there's so much more to be covered when it comes to mental health. And I
Yes.
really hope someday we get to a point where this is not a taboo anymore.
Yes.
And that this is not celebrated just on that one day.
Yes.
But mental health deserves the kind of attention that one normally needs to have in the society at large. So thank you so very much for spending time with us. And here's wishing you a very happy World Mental Health Day again.
Thank you, Sriram. Thanks for having me.
How does one reach out to you if they need to seek help from you? If one needs to sit with you and have a conversation, how does one reach out?
If you can just call Cadabams reception, and I think you'll be able to see us.
Lovely. Thank you so very much.
Thank you.
Fever.